Hello, my name is Dr. Jose Palayo, and I'm here with a renowned expert in restorative medicine, Dr. Dzugan. Dr. Dzugan is author of 5 books on restorative medicine and has published 170 articles in medical journals around the world. It's a pleasure to speak with you today, Dr. Dzugan.
Hello, Dr. Palayo, and it is very nice to see you again. And thank you very much for the invitation to discuss a few very important age-related topics today.
Dr. Dzugan, one of the questions asked often is the difference between chronological age and biological age. For the viewers, could you kindly explain the difference?
Yeah, simple way to explain it, chronological age just show number of years that you spend on this earth.
Okay, so if I'm 50,
It's
that's
your
my chronological age.
Yes.
Okay.
A biological age, this is a complex of signs that show how you look like, what's going on with your body physiology, body environment, your biochemistry. So you saw probably many people who said, I am 55, but they look like 75. Okay. And opposite, some people in 75 look like 55.
Okay. And what are the major contributing factors that would cause a person to have a biological age older than their chronological age?
There are several factors.
Okay.
Environmental things play a big role.
Yeah, what you eat.
Yeah, what we eat, of
you
course.
Don't exercise.
Diet, exercise, etc., etc., etc. But the problem is, we can stand on the head, we can drink carrot juice, we can do a lot of exercise, we can use any kind of diet, but unfortunately, until we will restore hormones, we will be decline.
Okay. So
because hormones, again, they play crucial role to keep your body metabolism in good shape, your body physiology in good shape. And as soon as you will lose balance between building hormones and destructive hormones, you will start to have problem.
Okay. So you're saying that the hormone balance or lack thereof is the primary reason why a person would age faster or have a older biological age. Is that correct?
Like I said, we can do excessive exercise and have a healthy lifestyle and be pure vegetarians, but nothing will work, nothing will help until we will restore useful level of most powerful agents, hormones.
Okay.
Because they're in charge and they communicate with each single cells, and they tell to each cells what they should do and when.
Disease then is a consequence of an imbalance of hormones, which is the major or causative factor of biological aging.
It is correct. Yeah, it is correct. And if you'll take main causes of death in the United States, we know that first 2 places belong to heart disease and cancer. So this problem usually happen after age 40. More than 95% of people have this problem after age 40, when our body has significant decline in production of hormones. Again, we talk about homeostasis. Our body tries to fix immediately any problem if you have any damages or any imbalances anywhere. So our body tries to do it. But when you do not have enough these building forces, you start to decline and you quickly deteriorate if you have low level of hormones. So your metabolism will be slow, your absorption can be slow. That's why we talk about physiologic medicine, because not everything should be treated by drugs. Our body doesn't produce Lipitor. Our body doesn't produce different Ritalin or Zocor or some sleeping or Ambien or some birth control pills. Our body doesn't produce it. So we need to respect what our body does. and we need help body instead of interfere.
How individualized are these programs?
All programs are very individualized. We can include in their programs similar agents, but dosages can be different. Time when you take can be different. Application can be different. Everything can be different. We always individualize program based on basic information and then on feedback from our clients. If two persons have very similar blood tests, but we give not the same but similar program, when patients or when clients start to use this program, we can get different response. So we always need to hear our clients, because each person like guitar or like piano, and if you want to find a good tune, we need to produce sound and hear and listen how the sound will be, even for two patients, because your clinical history can be different, your age can be different, your weight can be different, your blood test can be different, and then we always take in consideration follow up from our patients. We always collect information how clients tolerate this program, and we can make multiple adjustments. So programs very individualized based on this unique information.
Is it safe to say that the program treats the underlying cause as compared to being a program that treats symptoms? Is that correct?
It is correct.
Okay.
We keep in mind what kind of complaints, what kind of symptoms patients have, but we never treat the symptoms. What we do, we restore optimal functioning of body physiology. We try to fix broken chain, and then we get feedback from our patients and see what we can do as a next step. We keep in mind all the symptoms and complaints, but we always restore the body physiology. And body physiology, when it in optimal phase or optimal condition, it will take care of symptoms. So symptoms will disappear if you will restore body physiology. So you do not need chase any symptoms, because when you try to fix just one symptom, you can create another problem. I will give small example. For example, woman has hot flashes. So the first step, what majority of doctor will do, they will give just estrogen. But the problem is, majority of patients, even when they have low level of estrogen, they can have extremely low level of hormone that balance estrogen. So if you will give estrogen alone, you can get another problem. So you can get, for example, breast cells proliferation or cells division, and you can get a breast cyst or breast cancer. So it's wrong approach. We need again look on our body as a whole system, not just different small pieces. You cannot ignore the whole body. You cannot treat a uterus. You cannot treat just breast. You cannot treat penis or prostate gland. You need to take care of whole body.
Okay. Yeah, it's not separate. It's completely.
Yeah.
It's one whole system that needs a couple little fixes, but fixing the symptoms is not getting to the cause of the problem.
It's that way.
Okay.
Because you will take more and more drugs for complication that you will get with use just some drug for symptoms. Another thing what we need to remember, many patients take 10, 12, 15 drugs. And this is foreign agents for our body. When we talk about program physiology restoration or restorative medicine, we usually use several agents that our body cannot produce enough. But during aging, or some vitamins or supplement that our body cannot absorb enough due to all these aging changes. But when you use several drugs, our body doesn't produce these drugs and has no any deficiency to these drugs. And it is shame that current medicine use, like I said, 10, 12, 15 drugs, strong drugs, but we do not have even one publication that tell us that it is safe. There's no publications, and we take all of them.
Yeah, medicine completely is symptomatic approach. I think it's got its place here, of course, but getting to the cause of the problem is always much better than attacking each individual symptom.
I completely agree. That's exactly right. Very simple.
And I know that the program has a section whereby there's communication or updates, which
Yes.
I believe.
Yes.
Is that the way that you get to tune
Yes,
the
this
guitar?
is most important part of the program. The biggest problem with majority of patients who use a good hormones, when doctor said, okay, I will see you in 2 months or 3 months. During 2 months, even during 1 day, anything can happen. You can use a little bit larger dose of magnesium or a little bit larger dose of estrogen, and you will have new symptoms, and patient will be completely confused, and patient will not like it. I always said that the key for success is updates, updates, updates. We need to hear from our clients how they do when they start to use program. Because again, when we talk about individualized program, we talk about each individual who is unique on this planet. So every time when patient get program, we need to hear how patient tolerates this program. What kind of symptoms were improved, what kind of symptoms were not changed, and what kind of symptoms, new symptoms patient has. So we can fix this problem in time. Again, for example, who start to use estrogen, and they had hot flashes before and vaginal dryness before program, and then they start to use program, they start to have, for example, breast tenderness or nipple soreness. So what do we need to do? We need decrease estrogen, or we need increase dose of progesterone. So we always need to talk to patient. It's like our body cells talk to each other every millisecond. So we need to talk to our clients every single day if we need, until we will fix problem. Like I repeatedly said, your body is guitar. So if we want to get a nice sound, we need to find your individual tune.
Out of all the patients that you've treated with this program, have you ever had anyone tell you they wish they waited longer to start?
It's funny what you said. It's basically opposite. Majority of our clients said, unfortunately, I don't know that I can do something for myself. I thought that this is normal aging process. It's not normal thing. Lose memory, for example, or have joints pain, or lose our sexuality. It's not normal. Why, for example, you're 55 or 60 years old should suffer from lack of sex? I do not understand this. It shouldn't be this way. So better, some patients said that I prefer to live as a hero and die during sex rather than to be a crampy old man and die from multiple deteriorative diseases.
When is the best time to start the program?
If you have symptoms, or if you have some conditions or diseases, immediately, right now. If you do not have symptoms and you're below age 30, you can wait until age 35 and start program. Okay. But the best time for people who didn't feel anything bad with their body, they should think about starting program after 35.
Okay.
Many nasty things happen. For example, if you talk about men, what happened? Testosterone production start to decline a lot. pregnenolone production, DHA production decline a lot. And then we wonder why approximately after age 35, many men have prostate cancer. When our body produces enough testosterone, we do not have prostate cancer. Similar situation with females. What happened approximately after age 35, production of two groups of female hormones changed tremendously. Production of estrogen declined a little bit, and production of progesterone declined a lot. And we start to have imbalances. And these imbalances lead to elevated blood pressure, constipation, arrhythmias, depression, fibrocystic breast cancer, fibroids, and other things. So if you see that you start to have any symptoms, you should do it at any age. If you do not have symptoms and you feel that you're completely healthy, you run a marathon and you feel great, but you're after age 35, probably you have already non-symptomatic phase of some aging process or destruction.
You're 35 years old, you've got to start now.
Yes.
If you have a symptom, a complaint, a
At any
disease,
time.
you've got to start now.
At any time,
Okay.
yeah.
But if you, whether you're, no matter what the age.
It is correct.
Okay.
No matter. And basically we did study in Life Extension Foundation, and we had presentation of Indian professor on IPOMS. IPOMS is International Physiology Optimization Medical Society. And she presented and we presented data where we show that only approximately 7% of patients in aging patients have slightly elevated level of cortisol, but 46% of patients have cortisol level less than optimal or desirable level. So what happened again, after 35, we want or we don't, but we are dying slowly, because cortisol is a destruction hormone, catabolic hormone. And our building hormones, such as DHA, pregnenolone, progesterone, testosterone, decline much more than destructive hormones.
One of the things I want people to understand is how simple it is to get on the program. And I want you to take this opportunity to explain. You know, if somebody wants to join the program, wants to get started, what do they need to do?
It is very simple. We need medical history based on extended questionnaire. We need blood test. Then we create individualized program. And then you see a doctor who will oversee your program and who will explain what you need to do and why. That's it.
It's quite simple to get started. There's a thorough medical questionnaire that needs to be answered. There's an extensive blood test that is drawn. And then from that two modalities, you create a program individualized for that person, who then is supervised by one of the affiliated physicians in the network.
It is correct. That's exactly right. Very simple.
There's no denying that folks come into our program with all different kinds of symptoms. And after they stay on the program for X period of time and their body gets to be normalized, one of the greatest side effects is that they start becoming happy. They start getting a euphoric feeling. Besides eliminating the conditions that they came in for as a concern, they also start feeling happy. What's causing their happiness, and why are we finding this to be such a common thing? I mean, I think it's great that all these patients are, feeling happy. What's causing this happiness?
Again, optimized chemical balance. Remember when I talk about homocysteine, I said that homocysteine is precursor of SEMI, and SEMI our body uses for production of several neurotransmitters and endorphins.
Okay, so in other words, we're creating we're getting more happy
chemical
chemicals.
molecules.
Okay.
Yes.
All right, so that's the end.
Yeah, when you have sex, you're happy and you sleep better.
People feel happy after we restore their balance, and it's almost like they got a new key to life. Okay, What's the power of this happiness?
Yeah, I think that if you'll take all real bad conditions like psoriasis, migraine, or some cancer, or bad heart disease with, a lot of deterioration, I think that the best way, the best thing that our clients can gain is happiness. We love when they're happy, and they usually said, I'm so happy, I'm so glad that, I use this program, I never will stop it. This is the best
Gift.
award for us.
Yeah, when patients, because clients are happy.
Yeah.
The power of happiness, it's been studied also, that the power of happiness also has a hormonal effect.
Oh, yes.
So what are you talking to me about that?
And happy people, they have much less illnesses. And like I said, there's several things that our body produces, and you can take also some hormones and some supplements that can help you with this happiness. So it's two-side direction.
Okay.
You improve some condition, you start to feel better, you do not have depression, you feel better, you are happy, you have less illnesses, so it's good by how I can say by two directions.
Bilateral.
Two directions.
Bidirectional.
Bidirectional.
Absolutely.
Yeah.
I know that in your heart and in the company's mission is to make people happy. At the end of the day, that's what we all want.
Yes.
We want to, and one of the things we want to die old and not sick. And one of the things that we're so used to, we don't die old. We die because there's a condition, either heart disease or cancer, the two most prevalent conditions that we know about. But it's normal. It is normal to die old. It is abnormal to die of a condition. Yet we have accepted that we have to have a disease to pass away.
Yeah, you probably read several emails when patients wrote something like this, that this program is the best investment that I had in my life. This is basically like very good healing medicine for us, for scientific team. So we feel so good because we know that that we can help people who suffer for so many years and they just had no way out.
It's incredible, the amount of members that we have around the world, and it doesn't matter where you come from. Physiology is physiology. Right. Biochemistry is biochemistry. And as human beings, as long as we're balanced and all the other factors that play, and happiness is the side effects, that's a great way to live.
Oh, yes. Yeah, I agree. Thank you very much.
Thank you very much, Dr. Dzugan.
Thank you very much, Dr. Palaya.
Let a DZ Logic advisor answer any questions you may have and show you how easy it is to get your individualized program started. It's a no-nonsense, no pressure, no hype conversation. From there, you decide how and when you want to begin managing and improving the quality of your life. None of us are getting any younger, but thanks to DZ Logic, some of us are aging a heck of a lot better than most. You can too. Contact DZ Logic right now.